Everyone right to go? Thanks very much. I'm joined today by Minister Pakula, who's going to speak about some vaccinated economy trials, further detail to be, if you like, infill to the roadmap that we had talked about some time ago. Deputy Chief Health Officer Deb Friedman is here as well. COVID Commander Jerome Weimar is here. First of all, there are 779 cases recorded yesterday, all locally acquired. That brings us to a total of 8,011 cases across the community. I'm sad to have to inform you that there are two people who have passed away, a man in his 80s from Moreland and a man in his 70s from Hume. We of course extend our best wishes and our deepest condolences to their family and friends. This will be a very difficult time for them. 82% of yesterday's cases were under the age of 50. There are 325 people that are currently in hospital. 73 of those are in ICU and 54 are on a ventilator. 4 people in their 20s are currently in intensive care. All of them are on a ventilator. 8 people in their 30s are in ICU. And 3 of them are on a machine to breathe. So that makes the point very clearly that this is now, by and large, a pandemic of the unvaccinated, and otherwise healthy people who are young, don't have a long list of underlying conditions, if not vaccinated, are finding themselves in hospital. That's not a point of criticism, it's just, I think, a point to motivate everyone to come forward and get vaccinated as quickly as possible. To that end, there were 34,280 vaccines administered in our state hubs yesterday, and of course GPs will have done their share. Community pharmacy will have done some yesterday as well, but the numbers we have the greatest visibility over, of course, are the hubs that we're running. So just over 34,000 vaccines administered yesterday. That's a very significant effort, and we thank all of the staff involved in that, and of course we thank those more than 34,000 Victorians who came forward and honoured the appointment they'd made and played their part in protecting not just themselves, but indeed protecting all of us and allowing us to open up and be free. We have reached a 77.7% of the 16 and over age group for a first dose, and 47.3% have received 2 doses. We are steadily making progress. Now, there's been a lot of discussion about whether we have enough supply. There's been some positive announcements, and some, I think 3 weeks of October is now confirmed, and we've got greater certainty over that, so that's good for all of us. But I can also confirm that, again, I'm not here to talk about appointments that are available in GPs and pharmacies, but I would say there is significant supply that is not necessarily forward booked in pharmacy. That's both Moderna and AstraZeneca. And in GP clinics, there are, we're led to believe, significant reserves there, spots that people can fill. That'll be both AstraZeneca and Pfizer. For our part, there are 3,495 Pfizer appointments over the next week that do not have someone's name beside them. So if you go online, you can make a booking, you can have one of those appointments, and you can, as I said, play your part in protecting yourself, but also play your part in getting us open and seeing less people across the community gravely ill and in hospital. Similarly, there are 6,984, so close to 7,000 AstraZeneca appointments available in state hubs that don't have someone's name beside them. So, for all those reasons and more, please go online, please book one of those appointments, please play your part. Now, in terms of restrictions, I'm very pleased to be able to announce that it's estimated on Tuesday we'll reach that 80% single dose number. That's a very important threshold. And of course, I think our single dose numbers will go beyond the 80% mark, which is very good. That means we can be very confident about reaching 80% double dose on the timelines that we've outlined. I thank everybody who by Tuesday will be part of that 80%. That's a fantastic achievement. And as we announced some time ago, that makes some things possible. We're not overselling this, they are modest things. It's not Freedom Day, it's not the end of the lockdown. That is getting closer every day though, but it is important to acknowledge that the Chief Health Officer has decided and has confirmed that from 11:59 p.m. on Tuesday the 28th of September, so in just a couple of days' time, there will be those modest easings that we spoke about a couple of weeks ago. In regional Victoria, the outdoor venue cap will increase from 20 to 30. There are some changes in hair and beauty and personal care. In metropolitan Melbourne and in those regional areas that are locked down, and Associate Professor Freedman will speak to those issues in just a moment, regional lockdowns. Residents will be able to undertake recreation at outdoor facilities, boating, tennis, golf, those things that we spoke about a couple of weeks ago. There'll be rules, there'll be some formality to that, and I think clubs and associations, we're working very closely with them, and there'll be advice to people who are engaging in those sort of activities, whether it be through a club or simply on the website. But that activity will be able to occur. It's been prohibited. It will now be able to occur from 11:59 p.m. on Tuesday night. So essentially Wednesday morning, those activities will be back. But it may look a bit different. It may not be the same experience at pre-COVID. There'll be some rules, but I think people will be delighted to be able to get back to those things that they're very, very passionate about. And that, as the Chief Health Officer has determined, they're outside with some structure, they can be relatively low risk. Importantly, to access those sorts of activities, and in recognition of the fact that we are on a journey to open up, not to remain closed, you'll also recall, and I can confirm today, that from that time, so 11:59 p.m. on Tuesday, the 10 kilometres moves to 15 kilometres. So exercise, shopping, and indeed those activities I've just talked about, you can now go 15 kilometres from home. We'd already confirmed the move to 4 hours. There's no change to that. There are some further changes to personal training, so 5 people and a vaccinated, or all fully vaccinated and a fully vaccinated trainer. And there's also some further changes to some of the rules that remained in relation to playgrounds. They're lifted as well from 11:59 on Tuesday night. What that means is that all of those things we said we'd be able to do once we hit 80%, we are doing, and that I know will be welcome news. I'm not overselling it to the point where it's more than it is. It's significant, but we've still got a way to go, and we've got to get to 70% double dose and then 80% double dose in order to firstly lift the lockdown and then have pretty much everything open at the 80% mark, with rules and with some limits, but open. All of those milestones, they're all dependent on people going and getting vaccinated. They're all dependent upon people taking up those appointments I spoke about before, thousands of them. That's just in state hubs. Beyond our state hubs, we know, because Anthony Tassoni was here from the Pharmacy Guild very recently, telling you and through you all Victorians the fact that the rollout of the Moderna vaccine in community pharmacy, there are literally tens of thousands, hundreds of thousands of spots. So please go to your pharmacist, please go to your GP, or please go online and book one of those state hub spots. There literally are thousands and thousands of appointments available, and if you take one of those, you play your part, then you'll contribute to not only these numbers and us hitting key markers and thresholds in the delivery of the national plan, you'll also protect yourself and the people that you love the most. We're not seeing people who are double vaccinated finishing up gravely, gravely ill or in hospital. If we are, it's a tiny number. It's a tiny number. What is more reasonable, what is more likely to assume, and what the numbers support, is that if you're double vaccinated, you're at lower risk of getting it. If you do happen to get it, you're at a dramatically lower risk of becoming unwell. And the more people that are in that position, vaccinated, that's less people in ICU, that's less people in hospital, that's less work for our nurses. So for every reason, personal and otherwise, please go and book one of those appointments, whether it be AstraZeneca or Moderna at a pharmacy, AstraZeneca or Pfizer at a state hub, or AstraZeneca or Pfizer at your local GP. There's no reason to not do this. It makes sense, and it's what will get us free. It's what will get us back to normality. That's why it's so important. I'm now going to ask Martin to speak to some vaccinated economy trials. You remember that we've talked a lot about the fact that certain parts of the economy will be open for those who are double vaxxed. And at this time, because it's simply too risky from a transmission point of view to have it as a mixed environment, if you like, so people who are not protected by the vaccine mixing and mingling and sharing spaces with those who are. We did say that we would trial this, the technology and how it's going to work. So as promised, we are delivering those trials, and Martin's here to talk a little bit more in detail about those. Over to you, Minster.
Thanks, Premier. As the Premier indicated, today we're announcing a plan for a series of vaccinated economy trials in regional Victoria as we get closer to the thresholds for opening up. Those trials are scheduled to start from the 11th of October. That's roughly a fortnight before we anticipate reaching the 70% double dose threshold, which at the moment we're expecting to occur on about the 26th of October. It's about seeing how our vaccinated economy system might work, and we'll trial that with higher patron numbers and crowds, with everyone on site being confirmed as fully vaccinated. So what it will mean in effect is that for those venues, events and locations which we nominate as trial sites, they'll be able to operate at that 70% threshold number. So whatever the details are at 70%, they'll be able to do that a little bit earlier as part of those trials. So it will tell us how the vaccinated economy system works for businesses, how it works for individuals, how it works for community organisations. So we're going to be nominating up to 20 trial sites throughout regional Victoria. We'll be doing them in LGAs with low case numbers and high vaccination rates. So the Chief Health Officer has, in the initial sense, nominated 6 LGAs where these trials can occur. They are Buloke, Pyrenees, Bass Coast, Greater Bendigo, East Gippsland and Warrnambool. If you look at a couple of those as examples, in Buloke, which is around Wycheproof, they have a double dose rate of 63% and a single dose rate of 88%, so very high vaccination numbers in Buloke. And in Pyrenees, which is around Beaufort and Avoca, they have a 64% double dose rate and a 90% single dose rate. So extremely high vaccination rates in those municipalities, and it marks them out as being perfect for these trials to be run. So in terms of the sort of settings and the industries where we think those trials might work, hospitality obviously, hair and beauty, tourism, some types of events, so potentially country race meetings, concerts, community gatherings, all of those types of events will be able to be considered for trials of the double vax economy. We'll be looking at how we can best establish someone's vaccination status as part of these trials, so how the Commonwealth Vax data can best be integrated with the Service Victoria app. We'll be looking at other proof of vaccination options as well, Medicare Online, the Express Plus Medicare app, hard copies of vaccination certificates that can be obtained through Services Australia. All of those different types of proof will be considered as part of the trials. We'll also be looking at what sort of training staff need, what sort of support business owners require, what sort of public communication of vaccine requirements will be necessary. So all of that will be fed into these trials, and we'll have support officers on the ground to help ensure that those trials run smoothly. For businesses or events that want to participate in the trials, we are encouraging you to get in touch with your peak body. So, if you're a pub, you might want to contact the AHA. If you're a restaurant, the Restaurant Caterers Association, the Hair and Beauty Industry Association, etc. We'll be talking to those peak bodies to help us select the venues that will participate in the trials. This is a really important step on the path to us becoming an open, vaccinated economy. We need these trials to ensure that we understand all of the potential issues that might arise, but moreover, we need people to get vaccinated so that they can, once we get to 70 and 80, attend these venues, attend these events, attend these concerts safely, and ensure that they don't catch the virus or pass the virus on to others. So these trials are a really important step along the way. They will be starting pretty soon, and I'd encourage anyone who wants to be part of the trials in those 6 municipalities to get in touch with their peak body. I should also make the point that's it's set out in the media release that once we get past 70, we'll be looking at a range of other settings and other locations so that we can then test the 80% settings in between 70 and 80. And that may well be trials run in metropolitan Melbourne, it may well be trials in larger, more significant events, and we'll have more to say about that once we've done this first phase of trials. Now I'm now handing over to Deb, and then Jerome, I think, then we'll take questions.
Thank you, Minister. Good morning. So yesterday we were able to advise that the Surf Coast LGA would exit lockdown at 11:59 p.m. tonight, and I'm pleased to be able to say today that we're going to be able to give the same news to the City of Greater Geelong. While there are still cases there, and perhaps in another environment and in previous times, we would have stayed in lockdown to drive those numbers down to a hard zero. But that's no longer in line with our management of this virus under the National Plan. Today we are reporting 6 cases that were in Geelong yesterday and one case in Surf Coast. We take into account many factors. We take into account the fact that many of these cases are linked to known other cases, the lack of any major exposure sites within the areas, and how well they can be managed by the local public health unit. We also look at high testing rates, vaccination rates, and also any changes to policy that can limit further growth in the short term. And this includes things like no travel between Melbourne and regional Victoria for construction. Unfortunately, we're not in a position to give the same news to the people of Mitchell Shire. Mitchell Shire, being directly adjacent to some of the local government areas that have the highest rates of COVID anywhere in Australia, is perennially vulnerable to these incursions from the suburbs that they are right adjacent to. And that's what we're seeing regularly, pretty much on a daily basis. So unfortunately, we're not yet in a position to release lockdown in Mitchell Shire. And if you live there, you can help your community by getting tested, getting vaccinated, staying home and staying safe. I wanted to touch on vaccinations, specifically on the sad death of 2 individuals today who had COVID-19. What's notable, their ages in their 70s and in their 80s, and these people had been eligible for vaccination from the first day of our vaccine rollout in Victoria. However, the 2 individuals who passed away were not vaccinated. That's not to make any sort of statement, it's just a plea from me as a public health official, as a physician, but also as a human being and a daughter. Please get vaccinated. If your elderly parents are yet to get the vaccine, please recognise that they're especially vulnerable. Please encourage them, because 2 doses of this safe, effective and free vaccine can save their life. And finally, from me today, I want to recognise the hospital workers, the nurses and doctors, allied health staff, ancillary staff who rise to the challenge of the increasing patients that we're seeing in hospital, to the administrators that create more bed capacity where there was none before with increasing hospitalisation rates, to the public health units who work tirelessly to trace and contain this outbreak all over our state, and the teams that monitor our COVID patients in the community and provide for their welfare on a daily basis. Thank you. Your work is very important and it's critical to every Victorian. I'll now hand over to Jerome.
Thanks, Deb, and good morning. 779 new cases of COVID in the last 24 hours. That takes us to 8,011 active cases of COVID in Victoria at this point in time. Our outbreak map is very similar to what we've seen over the last 4 weeks. Over half of our cases are in the northern suburbs, 417 cases in the northern suburbs, including suburbs such as Craigieburn, Meadow Heights and Roxburgh Park. In the western suburbs, we've seen 216 cases, just over a quarter of today's total, in Altona North, Point Cook and St Albans. In our southeastern suburbs, we have 93 cases, just over 10% of today's total, in Pakenham, Dandenong and Cranbourne East. In our eastern suburbs, we have 31 cases, particularly in Templestowe. And in regional Vic, there are 20 cases overnight, and I'll just spend a bit more time on the regional picture, especially given the news that Deb's just given. So of the 20 cases in regional Victoria, we have 6 in Geelong, all linked and connected and understood. We have 5 cases in Mitchellshire, 2 in Ballarat, 2 in Shepparton, and a single case in Bendigo, and a few other isolated cases here and there. All those regional cases, with the exception of a bit more work to do in Mitchellshire, are all reasonably well linked and understood, primarily primary first contacts of existing cases. There are 2 cases we're still investigating in today's total numbers. With regard to regional Victoria, I want to do a particular shout out to regional businesses, particularly as we take Geelong and Surf Coast out of those lockdown restrictions. Firstly, I want to thank all regional businesses for the really hard work they're doing to keep their work premises as COVID safe as they possibly can for their staff and for their customers. We've actually seen a really good record over the last few weeks of particularly some very high risk workplaces. If I look at our aged care facilities, some of our really difficult cold and meat processing facilities, avoiding having any COVID outbreaks in those settings. The surveillance work you're doing, the PPE arrangements you've got, all those COVID safe practices are really important in avoiding getting that transmission within your workplaces. In fact, in the last couple of days, we've seen a number of surveillance testing figures pull up some indications of concern, which on subsequent testing we've managed to remove from our investigations. It's a really important part, a really important control in some of our most delicate settings. So thank you for everybody who's working so hard to keep COVID out of your workplaces. We have those seen. If I look at the cases over the last week or so, I'd ask all regional businesses who are running office facilities and headquarters facilities where Metro staff or Metro employees or staff who live in the Metro areas are still coming into your workplace. Do they really need to be there? Is it really important that those staff are travelling every day or every now and then from Metro into those regional centres? We've seen significant outbreaks in Geelong at head office operations. We've seen similar outbreaks elsewhere. I'd ask for businesses to be particularly careful about training facilities. We've seen trainers from Metro Melbourne move into some regional centres to provide training, and in doing so, unknowingly transmit COVID or at least create exposure sites for COVID. Again, be very mindful about those specialist trades and individuals that you think you need to move in from Metro areas to regional areas. And finally, as always, staff gatherings. We have a case where there are 10 staff cases in one workplace associated with a workplace gathering involving a bit of food sharing. All, as usual, for understandable reasons, completely in contravention to the normal COVID safe principles. So food sharings, parties, gatherings are just not the thing we can afford to do at the moment, and not when in a workplace of 14 people, 10 walk away from that gathering being positive with COVID. So please, keep an eye out on your COVID safe plans, understand where your staff are coming from, and make sure that if you have got staff coming in from metro areas, that they're undertaking those full COVID safe protocols every single time. In terms of testing remains, of course, a really important part of how we stay on top of these outbreaks and understand and support those who are living with COVID. We've seen a really good response in Geelong, 3,773 tests yesterday. That's been doubling in the last week. Fantastic response, which has enabled us to get our arms around those positive cases and to make sure we're not seeing any further signs of community transmission at this point. We have more work to do in Mitchellshire, 450 tests yesterday. Those numbers have been fairly flat over the last week, and then again I'd encourage people in Kilmore, Wallon, Beveridge and other locations to really come forward and get tested if you've had any concern about exposures to those listed exposure sites or contact with people who we know to be positive. In the metro areas, we've seen a great response in Hume, over 4,000 tests a day yesterday and over most of the last week. We're testing about 60% more people in Hume than any other part of Metro Melbourne at the moment. Great to see people coming out. It is, of course, helping us to get a better understanding of where we're seeing that transmission, and the majority of that transmission continues to be within the home and between households. Again, I'll say, by all means, focus on those exposure sites that we list every day, but recognise that one of the most important, probably the largest single exposure site is the home. It's your home in terms of transmission within the home. It is certainly going to other people's households. That's what we're seeing the vast majority of people picking up COVID when we'd rather they avoided that. Finally, in Dandenong, we're seeing around 850 tests a day. Again, I'm concerned in the southeastern suburbs with the number of cases coming through day by day. Again, 93 cases yesterday. We'd like to see stronger levels of testing, more people coming forward to get tested in those southeastern suburbs. More testing facilities have been set up and will continue to be set up to enable people to do so. In terms of vaccination, just to add to the Premier's comments, not only are there 10,000 first dose bookings available in the state clinics in the next 7 days, the number of vaccines being made available to pharmacists and GPs are increasing steeply. In the next week or so, there'll be 600,000 doses a week going to GPs and pharmacists across Victoria. That's a fantastic opportunity for people to really start ramping up not only their first dose vaccination, but also to get their second doses done. So please, there are now 1,114 GPs across the state administering Pfizer and AstraZeneca, so you can also get your Pfizer appointments there. And there are 440 pharmacies already allocating Moderna. There'll be an additional 280 pharmacists getting Moderna next week, part of that big step up in the availability of both Pfizer and Moderna over the weeks ahead. So if you've not been able yet to make an appointment, if you've found yourself bounced back by your other sources, look at your pharmacist on every retail strip. They've now got their signs out on the street saying we're doing Moderna vaccines here. Talk to your GP to see if they've got slots for you, or of course come on to our state clinics. We really want to start accelerate this rate of vaccination, as we're now in the next week or so starting to see significant allocations being made available to our GPs and to our pharmacists. Finally, in terms of our ongoing work to deal with any risk of interstate travel, interstate incursions, in the last week, 631 people arrived from red zones into our airports, particularly into Melbourne Airport. 15 of those were sent back for not having the appropriate documentation or the right materials. 23 were moved into hotel quarantine, and 161 were returning Victorians travelling on the appropriate paperwork to enable them to do their home isolation and to finally get back. And we're very grateful to see them back, and of course we'll continue to support returning Victorians over the days and weeks ahead. With that, I'll hand to the Premier for questions.
I might just pick up on Jerome's point in relation to vaccinations as well. We had said we'd do 25%, we've in fact done 50%. We're going to keep doing the same numbers, we might even increase them. But as a percentage of the overall effort, I hope that percentage comes down. I hope more and more people are going to their pharmacy, more and more people are going to their GP, so that we can see that part of the system increase its share, and ours might even come down a bit. But ultimately there is supply available in all three places: pharmacy, GP, state clinics. Please make one of those appointments. There are lots of those appointments available, and that's how we will be first dose, second dose, and then we will be free. We will be beyond this, and that is very, very important. All of us are happy to take any questions you have.
Premier, this might be one for you or Minister Pakula, but with the vaccinated economy trials, how do you foresee that being policed? Is that going to fall to junior staff, wait staff, for example, to be checking IDs, checking vaccination passports?
Well, no, I wouldn't think it was junior staff. I would think it would need to be taken seriously, and people will be trained, as the Minister's indicated. There'll be a training element to this. This is critically important. If we want these venues to be open, if we want them to have capacities that are higher than would otherwise be the case if you were not insisting on only vaccinated people, then the total number of people at the different milestones in the roadmap, the numbers allowed would be much lower. So it's in everybody's interest, particularly the business, to take this seriously. But I think it's important to acknowledge at this point that the overwhelming majority of businesses understands how the system works. That's who's going to be doing that. Plus there'll be authorised officers, plus there'll be Victoria Police if that's necessary. I think people will do their level best to follow these guidelines, to follow these rules, because they know that that's why the place is open, and that's why it's open with 50 or 100 people in it, rather than closed or open with a very small number of people. So for every good reason, people will, I think, take these rules seriously.
Sure, but is there a safeguarding going on? We've seen a lot of vaccine hostility, people coming out, directing that at staff. Is there safeguarding going on ahead of the trials to make sure that businesses and their employees are protected?
Yeah, sure. Part of that expression of interest process is that we'll choose venues that we think are suitable for that trial. I would hope people behave appropriately and recognise that the staff member who refuses to take your booking or refuses to allow you in because you are not vaccinated, they're simply following the rules. They're working on behalf of all of us. So there's always, I suppose, the possibility of people becoming aggressive or whatever it might be, not being particularly pleased about the rules that are in place, I would encourage people to behave appropriately, and we'll be there to support venues large and small in the trials and indeed beyond them.
So
In terms of fraud-
vaccinations will be mandatory for the hospitality sector?
Well, that decision has not been made yet. And again, I think we've had this discussion a few times about a proper process that needs to be gone through. The Chief Health Officer has to do that in order for it to be lawful. But I would just say I think it would be strange if you weren't allowed to stand at the public bar to have a beer, but the person who was pouring the beer, unless you were vaccinated, but the person pouring the beer didn't have to be vaccinated. So I think that might be where we get to, but that's not a matter for me. It's a matter for the Chief Health Officer, and he is looking at all sorts of different sectors. But look, you just think about it. If you've got a busy place where you've got lots of customers coming in and out, got lots of staff, people are staying for sometimes a short period of time, sometimes a longer period of time. It just makes sense to have as many people vaccinated as possible. Hopefully everybody in that environment would have had two jabs, because the risk of people spreading it in those environments is obviously much, much higher.
Can you talk?
Oh,
You
sorry.
can absolutely hear from
Sorry,
Minister
can you-
Pakula.
He can
Like an hour
answer
if
this
you
one
want,
as well.
it's fine.
Just in terms of fraud, and obviously Chief Health Officer Brett
Yes.
Sutton's mentioned it a couple of times. I understand why we need a hard copy for older Victorians who may not use smartphones or whatever else, but you mentioned Medicare's app rather than the COVID Safe Victoria, rather than the check-in system that we currently have being trialled as well. Is that going to be verifiable? How will these businesses actually verify?
So as I understand it, there's a few different. It's not about the front end. It's about how you link up data behind the scenes, if you like, to give you the green tick or the red cross. Right? So you've got the Australian Immunisation Registry. You've got Medicare data. You've got all sorts of different places where these stories live. Right. The key point here is there is a 4-digit number. We've just got to link that with the Services Victoria app. So it's linking an application with a database, something that's static and something that's dynamic, so it's not quite as simple as it seems. But Danny Pearson and others have been working on all of that, with New South Wales also. So I think what Martin's saying, you can answer any other questions you have with it, it's just not quite settled, but we're very confident that we'll be able to link the two things together. And then as you check in, as you QR in, that will also serve to determine whether you have been vaccinated or not. Now you're right, Mark, to say there will be some people who don't have a smartphone, and they'll do it the old-fashioned way with a piece of paper. There'll also be, just for the avoidance of doubt, if you cannot be vaccinated by virtue of health reasons, for instance, then you would have the same status as someone who is green, because you haven't chosen not to be. You can't be. But again, I think many of those people would be taking advice from their doctor about whether they should be in some of these sort of environments, given that they can't be protected. Johnny, maybe Martin to add to it.
Yeah, that'd be
Sure.
great. Just because I suppose the main question is, will the linkage between the Services Victoria app and the database be ready in time for this trial? Because otherwise, you did mention the Medicare status, which
Yeah.
anyone can pull up on their phone.
So we hope so, but we're not entirely sure. So we are confident that the Service Victoria app, and Minister Pearson is doing this work, he's leading this work on behalf of the government. We're confident that the Service Victoria app will have access to the vaccination data by 11 October, but we're saying it's certainly within October. But we've also said that not being necessarily available on the Service Vic app won't delay this trial. So right now, if you've got a smartphone, you can show your vaccination status in your Apple Wallet or your other digital wallet. If you don't have a smartphone, we're saying get in touch with Services Australia and get a hard copy of the certificate. And we're hopeful that Services Victoria will have that interaction with the Commonwealth Vaccination Registration or Register by October 11. But if it's a few days later, we'll proceed with this trial, notwithstanding that.
Those Medicare vaccination certificates, essentially both online and in hard copy, can be easily manipulated. Will there be any provisions in place to ensure, to check the authenticity, particularly hard copy back certificates?
Well, look, I'm not a technical expert on the security of the Medicare system. I understand that the Commonwealth is working very quickly to try and protect that system from fraud. I have seen the reports which say that there is some ability for a smart hacker to try and alter that digital record, and I understand that the Commonwealth is working to protect it from that. But that's really part of what the trial's about. The trial is partly about ensuring that we understand all of those different pressure points and all of those different possibilities, so that by the time we get to 70 and 80%, we've got a much better idea of what's secure and what's not. So I think, I think the IT that's behind this is getting better all the time. I know that in other parts of the world this has been done in a way that's that's protective of attempts to defraud. I'm quite certain that the Commonwealth will get there here as well, but we can't let the availability of the IT solution delay us unduly, because 70 and 80% is coming upon us quite soon, and we need to run these trials to make sure that we've got all of the answers to questions like that.
Is there a possibility that we get to 70% double dosed and it's not in place? In terms of a verifiable way via Services Victoria?
Oh, well, it would be heroic for anyone to give absolute watertight commitments about the availability of IT solutions, but we are working very closely with the Commonwealth. Services Victoria are doing all the work, and we think that certainly sometime in October, that Services Victoria app will be able, there'll be a scannable ability to show your vaccination status.
So I suppose the better question would be, if it's not ready in time, will that in any way, or shape or form impact the number of people allowed in venues if there's not a verifiable way of doing that through Services Victoria?
No, look, the roadmap has various things that people will be allowed to do at various numbers when we reach those numbers. That's our expectation. That's what people will be able to do, and we've got, we'll have as much IT support for that as we possibly can, and we'll make sure that businesses are very clear about what their obligations and their rights are and what support they can expect when we get to those numbers.
We know Sally Cap was very vocal about trying to get this kind of trial here in the CBD to try and reboost,
Yep.
I suppose, the economy here. Is there a chance that you could see the CBD using this trial at all?
Well, look, as I indicated in my initial comments, the 6 LGAs that have been chosen are based on vac status and cases, but they will be those that we initially use between October 11 and when we get to 70%. So that's a 2.5 week period, hopefully, provided people keep getting vaccinated. What we've also indicated is that from 70 to 80%, we want to trial in a range of other settings and in a range of other localities using the 80% numbers. So, for example, at 80%, the roadmap says that you might be able to have events with up to 5,000 people. So we might have some, things closer to Metro Melbourne, whether in the city of Melbourne or in the suburbs of Melbourne, where we can trial those numbers in real life scenarios in a different set of LGAs, but we'll have to have those conversations with public health about where it would be appropriate to do that.
Could that be something like the Melbourne Cup?
Conceivably, yeah, conceivably. Look, we would hope that, and as the Premier indicated a week or so ago, that we'll be at 80% by Cup Day. That's certainly what we're striving for. Now it's going to be touch and go, but yes, conceivably, that's the sort of thing that we could potentially run a trial at if we're not quite there.
Given that we would like to be there by Cup Day, and maybe it's one for the Premier in terms of National Cabinet and vaccine supply, but are you actively considering cutting down the wait for Pfizer vaccines from 6 weeks back to 3 weeks, given that, as you indicated, we've seemingly got some decent supply?
I don't think I'm the one to answer that.
Certainly try, Mark. Just further to Minister Pakula's very well made point, of course you can't do trials in Melbourne while Melbourne's locked down. So as soon as we're out of lockdown at 70, then we've got all sorts of options that we can. There'll be lots of stuff happening in Melbourne. In terms of the interval between first and second doses for Pfizer, as I've said to you a few times now, they're not political decisions. They've got to be made on advice. That was not when I think I was up last Thursday. I think when I spoke last Thursday, that was not an option because we simply didn't have enough certainty about what was coming to us in the 3rd week of October. I think we still need a little bit more certainty about what's happening. I think we've got 3 weeks of certainty. We need 4 weeks. Otherwise, you can get yourself into a really difficult position. If you start taking what are currently second doses that are waiting there for people to come along when they're due, if you start taking those for first doses, for instance, or if you change the balance, or if you do more second doses than you had planned, is probably the better way to put it, more second doses than you had originally planned, and that stock is not replaced, then you're going to run out of second dose vials. So as we get more certainty of Pfizer supply, and pleasingly we've had some of that, but as we get more of that, then it becomes a real option for us to potentially bring forward, whether it's from 6 to 4 to 3, and that would mean that we were getting more people into that double vaxxed 70% number faster, but it's all about how much is in the fridge. It's got better since I last spoke to you, but I don't think we're ready, I don't think we're able to be able to make that decision today, but hopefully we can make that decision soon.
So what is the balance of first versus second doses you're expecting to do throughout October, given that we're going to get to 80% in 2 days' time?
Jerome might be able to give you a more detailed understanding of that, but the key point is just to go back, if someone's sitting at home watching thinking, well, why can't we just speed this up and get there faster? We may be able to, but at the moment we don't have either stock on hand or committed, guaranteed stock arriving over the next 3 or 4 weeks for us to be able to change the 6 weeks down to something less. If we get more stock or certainty about what's coming to us, then that absolutely can be an option, and we would definitely look at that, because it would mean that we would get to our double dose targets faster. You just got to have the stuff. You can't get it into people's arms if you haven't got it.
Thursday or Friday, Lieutenant General come through and he said that Pfizer has assured Australia it will receive 9 million doses of COVID vaccine next month. Those supply issues had been, I guess, resolved. And he said that those updated figures would be provided to state and territory governments. Has he provided you with those updated figures?
I think we have some greater certainty, even just in the last few days, than we had Tuesday, Wednesday, Thursday last week when Jerome and I spoke, not through a sense of criticism, just to, I think we were asked the question, can you shorten the interval? And the answer was no, I don't have enough stuff. That's getting better. The other thing too though is that Pfizer's supplying Australia. The key point there is it's not just supplying state hubs, they're supplying us, they're supplying GPs as well, and that means that the whole system is there for people to use. But from our point of view, we're not quite at a point yet where we can make that change. Hopefully that becomes an option to us really soon, and if we can, anything we can do to get more jabs in more arms or to get us to these thresholds quicker, absolutely we will. That's why I don't think we ever thought we'd have 55 state hubs and pop-ups everywhere, and we're certainly doing more than we thought, and it's working. It's absolutely working as these numbers tick up.
So will you look at possibly manufacturing Moderna here then as one way to try and get more?
No, we've got sufficient supplies. There's sufficient supplies of Moderna. I'll have a bit more to say about Moderna and some things we're doing in that space quite soon. But Moderna is principally community pharmacy. They've got literally hundreds of thousands of doses. They're geared right up. It's only been about a week since they started, but all the reports I get is that they're working really well. So you can go and make an appointment at your pharmacy for AstraZeneca or the Moderna vaccine. Our state hubs for AstraZeneca or Pfizer. There's no Moderna in our state hubs at this point, and then GPs have got AstraZeneca and Pfizer.
Vax passport trials, I guess even home quarantine, etc., they will rely on the state of emergency powers that's due to expire at the end of the year. I know you're in the process of drafting bills. What stage is that at, and when will you release those draft bills?
You're right to say that we're still doing that work. It's not concluded yet. Cabinet's not finished. It's deliberations on those matters. As always, we'll have those out there in plenty of time, and that process of negotiation and discussion with the crossbench and others will continue.
When do you think that might be able to happen? Because I think it's expiring mid-December, I believe.
Yeah, I'm not sure. I can't give you a date, Samara, on exactly when we'll have a bill in the Parliament, but obviously I don't have a photographic recall of when the sitting dates are, but we'll get it. We have to get it done by the date you've nominated, and we'll achieve that. Otherwise, all the rules don't have a legal underpinning. The rules that'll be by that stage, we're very much about being open and staying open. So yes, we will need to continue those legislative arrangements.
The reports on Jeff Shedd potentially being a makeshift hospital, is the system
all
that
right.
under strain that something
No.
like that needs to happen?
There were some reports about this being something that's like going to happen next week. That's not accurate. It's not even, I think, a live plan. There was discussions last year about whether you, because again, we didn't know, we had no vaccine, and we didn't know how bad things were going to get. So there were all sorts of different things done last year around field hospitals and things of that nature. We're doing everything we can to try and avoid having to get to that. Now, there's a lot of talk about the 4,000 ICU beds. If we need to flex up to that, we will. But no one should, like, I don't think you want the government to be essentially recruiting people into ICU beds, like as if that's some sort of a desired outcome. Like, we'll open beds as we need them. We will change the way the hospital system works as we need to make sure that the sickest patients always get treated quickest. But no, I don't think it's going to come to that. And we're certainly working as hard as we can so that we don't need to be doing field hospital options. But again, money is not an option. Money is not a problem or an obstacle, I should say. Money is not an obstacle. Consumables and equipment is not an obstacle. The biggest barrier at the moment is how do we source the types and the numbers of people that we need, given how fatigued people are. Like, our health staff have done such an amazing job over this 21 months. You know, there is a sense of fatigue there. It's also very, very challenging work. All health work is challenging, but these patients are very, very difficult work. So they're not, and plus, not everybody is a critically care trained nurse. You don't produce one in 5 minutes either. Like, these are highly, highly skilled people. So there's always limits on that. But there will be, so it's not about funding, it's not about equipment, it's not about consumables and PPE and all that sort of stuff. There's enough of that. That's the advice I have. There's enough of all that. It's more about staff and trying to manage fatigue. And the other thing too is that you don't open ICU beds and have them sit empty. Like, you open them when you have patients to put in them. But no one should be barracking for 1,000 people in ICU, or let alone 4,000. Like, that. If we get to that point, and we may, that is very, very challenging. Very challenging.
When you say you could flex up to 4,000 beds if you needed to, do you have the staff to do that?
Oh, well, again, as I've said, and I've been at pains to make this point, you know, whether it's 2,000, 1,000, 1,500, whatever the number is, right? You start to get to those sorts of numbers. You can't flex up to that and maintain that for weeks and months. Like, that's incredibly difficult because the staff you've got, well, there's only so many double shifts people can work. So, and we've recruited more staff, and we'll move people around, and we'll try and, you know, balance things differently and all of that. And our staff will work with us, I know they will. But there are limits. There are limits, and as we've seen in so many parts of the world, you know, you can get to an unrecognisable peak, like get to a place that you never thought you were ever going to need to get to, but you can't stay there for very long because your staff just, you know.
Given those limits, should you have promised those 4,000 last year?
No, well, what we did was we went and bought as many machines as we could. We went and bought as much PPE, as much equipment as we could, and that was what we could have done for a period if we'd needed to last year. Couple of points. One, we had no vaccine last year. No one knew, and it was best that a whole lot of ventilators were in our warehouse rather than in somebody else's warehouse. It's also very different. We're a full year on now, and the notion of sort of fresh legs and these whole fatigue issues, they're very real. They're very real. There's been no easy days in the health system in the intervening period, Rachel, is the point I'm making. And the other thing too is this is Delta. It's not last year's COVID. It's very, very different, both in terms of the speed with which it moves, the seriousness of illness with which it that our nurses have to treat. So it's not only more infectious, but people are getting sicker when they have this. And again, passage of time. You know, there's only so long you can keep this going, and it's a bit like, I don't know how many times we've sat here and talked about all sorts of fatigue in the Victorian community, and people visiting, people not following the rules, all that sort of stuff. The fact that we're all tired and want this to be over. Well, our nurses are tired too. So what we planned for last year and what we hurriedly went and bought up is not necessarily relevant this year because it's a different virus. We're 12 months on, and again, I just say those sorts of capacity issues and 4,000 versus 1,000, that's not stopping us from opening up. The thing that's stopping us from opening up right now is that we haven't got 70% double dose and 80% double dose, but we will very soon.
Just on another issue, do you back the PMs?
Jerome's waiting here just quietly. He's on the balls of his feet to
got questions for
answer a question that we've all forgotten what it was. Sorry, do I back
Do
the
you back the
PM on what?
PM's view that state borders should reopen once vaccination rates reach 80%?
I certainly hope so. I certainly hope so. But again, with the greatest respect to the PM, that's not his call. That's a call for chief health officers and for premiers. And the national plan, which we are faithfully delivering, doesn't really go to these issues. Doesn't really go to these issues. No one's locked into having borders open. I want them to be open. I want people to be able to travel across their state, interstate, travel overseas if they think that's something that they want to do. But again, I can't predict that beyond that. You know, what I would hope. We have to wait and see how things go and how many cases there are. Just like I don't think the Prime Minister would necessarily be able to give you a definitive list of all the countries that are going to be able to be in travel bubbles with us right now. You'll have to wait and see.
Over the past couple of weeks, we've been rightfully focused on Melbourne's northern and western suburbs where cases have been high. We've
Yes.
been flexing up both testing and vaccination as
Yep.
well. As Jerome mentioned before, there is some concern in the southeastern suburbs. Again, it's a younger population, mobile workforce, fewer rates of GPs and pharmacists per head compared to more affluent areas. Before those areas get to what we're seeing in Melbourne's north, for example, is there a possibility to increase vaccination, testing, and just go really hard and be proactive about
That's
it?
exactly what we're doing. Yeah,
Reactive?
that's exactly what we're doing. But when I say we, you know, our program is only a part of the overall program. So I don't want to sort of have an argument for its own sake with the Commonwealth or anybody, but like we have complete control about where testing sites go, for instance. So when we have a problem, we have more testing done in that area. We don't have complete control about where GPs are, about which GPs are actually accredited. Then where pharmacies are, that's not a matter for us. So I think we've always shown a propensity, a willingness, and we've in real terms, we have actually gone and targeted our efforts. But not every effort is ours, and not everything can be controlled by us. But just as Jerome called out the need to test, so will I. If you're in the southeastern suburbs and you've got any symptoms, it's especially important that you go and get tested. And indeed anywhere across the whole state. If you've got symptoms, there's so little cold and flu around. If you've got symptoms, you've got COVID. That's what you've got to assume. So yes, Samay, we will do more, as much as we can, to target those areas, just as we have been doing in the north and the west.
So there'll be pop-up clinics,
Yeah.
more state-run hubs, for example. And I know it's...
Well, not necessarily more state-run hubs. There's quite a few out there, and they're very busy. They're very busy. I haven't been to one myself, but Kath took Joe to one recently, and was very busy, very, very busy.
And just in hindsight, I guess, you know, we need to learn lessons from this pandemic, you know, in the probably very likely circumstance we'll experience another pandemic in our lifetime. Do you think rolling out vaccines or having the GPs as the cornerstone of our vaccination rollout was the wrong decision, given the inequitable distribution, I guess, of GPs around the country?
Samaya, can I say to you that I don't think it would be useful for me to speculate on that matter. We're still asking. I don't think it's right for me to be running some commentary, and I may have all sorts of different views on those matters, but we're still asking, like right now we're asking a lot of our GPs, and I don't want to be in any way detracting from the work that they're doing. They're doing a great job. We're proud of them, we're grateful to them. They've got a lot more jobs to do, so do we, so do community pharmacy. This is the system we have, and now we've got to get people through this system and get our numbers up.
And just on one final point on this, given we're most likely going to have booster shots, we know
Yes.
the rates of GPs around the state. Do you think the vaccination, how will we sort of start targeting or be able to distribute a lot more vaccines to those who are most at risk of contracting
Sure.
and transmitting the virus?
Well, the question will be, again, the question sort of hinges on the term we. So in terms of boosters, there's been no decisions made about how booster shots will be done, the priority order, what the distribution mechanism will be. I'm sure there's lots of advanced thinking about that, but I don't think it's settled yet. So I'm not sure what role we'll be playing, whether there'll be more state hubs still doing boosters, the same sort of tripartite thing with pharmacy, GP and us. You'd have to ask the federal government about that. But I know we are reassured at National Cabinet repeatedly that the orders have been placed, they've got them. If they haven't got them, they're coming. Like if that's all in hand. Then it's a matter of who needs a booster and when, and how do you prioritise. There's a lot of work in that. But if you're really asking me this, will in the booster program there be learnings from the original first and second dose rollout? Yeah, of course it will be. people would expect us, all of us, to use that massive exercise, never been done before, really, and to learn from that.
Just a quick question before we hand it over. Will students over the age of 12, maybe a little bit premature, but will students over the age of 12 need to have had one dose of vaccine before they can return to school next year? And will year 11 and 12 students have to be fully vaccinated?
I think I know what you're referring to, and you know, there are lots of staff around the place and people to think about all sorts of different possibilities and options, and I can tell you as the person who chairs the cabinet committees that make these decisions, I've never seen that piece of paper. It's of no standing, and the schools plan was announced by the Deputy Premier and Education Minister the other day, and those things were not a feature of it because they're not a feature of it.
Just on that though, what is the government's sort of policy or advice for schools who might be dealing with large contingents of their community who are philosophically against vaccines?
Well, they're there to serve their local community. If there's a philosophical objection, then they're probably not going to be able to change that. But those schools will pose a greater risk to public health. We've already seen that. We've seen that with one school, one community school where I don't know what the case numbers are now. It was 60, 70 cases. You know, this is not good to get, whether you're 5 years old, 25 years old, 50 years old. It's not good to get if you've not been vaccinated. Now, littlest kids can't. Now, that may change next year. Who knows if there's a children's vaccine come forward. But, you know, we've all of us got to do everything we can to try and make sure that our schools are as safe as possible. So it's about airflow monitoring, making sure there is the best ventilated spaces possible, air filtration, compulsory vaccination for staff, all those things. I would expect our schools to be encouraging as much as they can everybody that deals with them to have had 2 doses, to be fully vaccinated, to be fully protected, because by its very nature, particularly for primary schools, the largest group of people in the primary school is not the staff, it's in fact the kids, and those kids cannot get vaccinated. There's no vaccine for them. So, you know, this is why we send these messages every day, and we're out there speaking to groups large and small in every language, from every background, from every point of view. Please go and get vaccinated. That's how we get free, but it's also how we stay safe.
Is there any policy advice coming to schools though from the
there's
government?
there's an enormous amount of policy advice and work that's almost continuous between the Department of Education. And the other thing to acknowledge in your question, I think you probably do in the way you framed your question, is that the school system is not just government schools, it's government schools, independent schools, Catholic schools. I'd encourage everybody 12 and up to go and get the first dose and then go and get the second dose, because it will mean you are at a vastly lower risk of finishing up in hospital.
Is hotel quarantine at capacity? We're aware of a COVID case, who was going to try and get into hotel quarantine to protect her family, but was told that she couldn't get in because it was full.
I'm not sure. Happy to chase it up for you. I know that there's a lot of people, exactly as you described, so not internationals, but people who can't safely isolate, that we've been looking after. But if you give me the specifics, I'm more than happy to fold that up.
Just back on that anti-vaxxer philosophy, obviously we don't have protests today, but have you heard any reports of GPs or others struggling with appointments being booked by people potentially of this group who are then just not turning up?
I have seen a bit of reporting of that. I haven't had it directly briefed to me. I've seen some reports. But I'd encourage people. That's not the sort of behaviour we want to see. That's just not there. You know, you might have a view, but don't stand in the way of other people expressing their view. Like, you know, you're pretending to take an appointment. That means that someone who wants to turn up and get vaccinated so that they can, you know, save their life and the life of others can't get an appointment. Like, that just doesn't make any sense. That's the wrong thing. The wrong thing to do, if in fact it is happening.
I don't want to offend Jerome, but I did have a question for the Minister about the grand final, if that's...
Very good.
Can I just ask the Premier on the grand final, and we can segue into Minister Pakula, should will police be breaking up groups of long-suffering Demons fans gathering together, or will police be cutting them?
Well, let me just say this, police matters are matters for police, so you have to talk to them about what they're going to do in an operational sense, and I'm not here to should, would, could and all that. That's a matter for Victoria Police. It was a great win by Melbourne Football Club last night, and on the point though of long suffering, like, we're all long suffering, so let's not any of us do anything that makes this pandemic event longer, makes this lockdown longer. There'll be a time to celebrate. We're all looking to the weeks ahead of Christmas and Christmas where all of this is behind us. So let's not any of us do anything right now, despite how, you know, happy these fans will be. Let's not do that because it's against the rules. Long suffering, relative term. One for the Minister, and then Jerome, there's a heavy line of questioning coming your way. Minister.
Minister, the consensus seems to be that Perth put on a pretty good show. What did you think of it? Did you watch?
Yes, I watched. It was a great grand final. It was, I think halfway through the third quarter, you could not possibly have predicted what was coming. The Dogs were playing really well, and the D's just overran them. Look, Optus Stadium looked fabulous, and I'm sure all AFL fans thank the West Australian Government for providing a venue for the show to be put on, and we're very much looking forward to having it back at the G next year.
You don't want to share it around?
Absolutely not. No, we've got, I was thinking someone might ask that. No, look, we've got a contract with the AFL to run the AFL Grand Final at the MCG until 2059, and that's what will happen. Now, obviously the last 2 years for dedicated footy fans has been a bit painful, although I think, you know, for Melbourne supporters probably the pain would have been a bit sated last night. But yeah, look, it's been difficult to see the grand final played in other locations. We're looking forward to having it back, and then having it back here for the next 37 years thereafter.
You said never again last year. Are you confident that it's absolutely never again this time around?
Well, last year, Rachel, no one was vaccinated. This year, you know, as of yesterday, about 47% of Victorians are double vaccinated. Next year, that won't be the case. Yes, I'm absolutely confident. We've got, you know, look, we had a really good start to the season. We had the Anzac Day game here with almost 80,000 people. And until we had that incursion, it was all looking very positive. Unfortunately, the outbreaks happened at the wrong time of year for football. I don't expect that will happen again.
Do you remember the
We're going with a memory exercise. As we do
3 weeks and 4 weeks.
I'll do 3 sets of questions in one go. In terms of students and vaccination, so we've seen a phenomenal uptake by 12 to 15-year-olds and 16 and 18-year-olds of vaccine in the last few weeks, given how relatively short the period has been. So 31% of 12 to 15-year-olds already first dose vaccinated, 62% of 16 to 30-year-olds already first dose vaccinated. And those rates are going up really quickly every day. So I would say with the gap coming up on the 5th of October, if you've got a year 12, year 11 at home like I do, make sure they're vaccinated. You've still got a week to get their first dose in, and there are appointments available in state clinics, and there are appointments available in pharmacy and in GPs to get that done. And we're seeing that enthusiasm. You know, the kids are doing us proud actually in terms of how quickly they're getting on with the vaccination journey. So Mayor, in terms of the doses and particularly the Dandenong issue, so yesterday I went through at some length vaccination rates in different councils. Casey 75% from memory, Cardinia 72%, Dandenong 70%. And we've been talking over the last week or two around all those additional pop-ups we've had down there. So Dandenong Market has done 7,000 or so doses over a fairly short period of time. We had Springville Town Hall, that's been really busy down there. We had some colleges around there, Warren. So we've done a lot of pop-ups in the southeast, as we have done in the Hume area and the north, and we'll continue to do that over the days ahead. In terms of dose allocations, again, I went through all those numbers yesterday at some length. I think some of them were in the age this morning. So we are seeing that really big step up of doses being made available to GPs and pharmacies, which is good news because it allows us to focus on the 200, 250, 300,000 that we're getting a week, about 250,000 a week on average in October. But the lion's share, 600,000 doses in total going to GPs and pharmacies over that month of October. So we really want to see that being used to maximum effect. And we will, we'll be working very closely with them as we have been to ensure that system works for people. And then Mark, in terms of the first, second dose allocation pieces, so we made a conscious decision, which we talked about at the end of August, which was to lengthen that gap on Pfizer from 3 to 6 weeks in state clinics, because we had so little vaccine available to us. So we lengthened that period out. That allowed us to hit at least over 250,000 doses a week through state clinics, more than we were getting, but we've managed to harvest all that benefit of delaying the second doses. Those second dose appointments are all booked in our system, and people who've got those second dose appointments will come and get them during the month of October. Over the last 3 or 4 weeks, we've been running around a 3-to-1 ratio of first doses to second doses in the state clinics. So we're averaging around 200, 210,000 or so first doses a week over the last few weeks, and 50, 60,000 or so second doses. That will shift in about 2 or 3 weeks' time as those second doses become due. We will start doing 200,000 plus second doses a week in about 10 days' time, 2 weeks' time. We'll keep going with first doses where we can, but if we're only getting, we're grateful for it, but if we're getting 260, 270,000 doses a week from the Commonwealth, that's 200,000 doses a week of second doses that are due. We can't bring that forward unless we get more vaccine on top of that. So that's the mathematical challenge we've got. Our absolute commitment is if you've had your first dose in a state clinic, there's a second dose that is timed, ready for you to come in, please come forward and get that appointment. And we'll continue to work with the Commonwealth and with primary care around what other options there are. If there's ways for us to bring those periods down, we'll absolutely do so.
Just on those Pfizer allocations, my understanding is that in the 3rd week and the 4th week
Yep.
of October, it's 692,000 doses each. Does that accord with what you're aware of? And
Each in what?
in
sorry?
each week, so 692,000.
Across primary care and the state
Yes.
system? Yeah, that sounds about right.
Yeah, so I think the Premier said earlier there was some doubt about that 4th week of
So
October.
we-
Is there still that doubt?
So the 3rd week of October is confirmed, so the 1st, 2nd and 3rd weeks of October are all confirmed and locked in. We begin an indication on the 4th week, but it's not yet confirmed. So, General Freeman runs a really tight ship and a very clear program of indicative, the original Horizons document gave us a very clear sense of what we might expect, but then a very clear system of locking in so we can plan and we can make those appointments. What we've never had to do, because of the clarity that he's given us and the way we've operated our system, we lock in appointments where we're confident we're going to get the vaccine. We're not going to sign people up for an appointment and then say, oh, actually, yeah, it turns out we're not getting the doses, so we have to cancel you. So we do not want to be in that world.
So that 4th week it is in the Horizons document, but it
Fourth
hasn't
week, we've been
confirmed?
given an indication that's what they're aiming for both primary practice and for ourselves. So we'll plan on that basis, but we're going to be a little bit wary around locking in appointments to that number until we get a bit further down the road.
And just on one other matter, how worried are you about the potential for last night to have been a super spreading event from illegal?
Oh, look, I mean, I think we
gatherings?
talked about it yesterday, we talk about it pretty much every day. Household transmission, households getting together to watch footy or do anything else is a really high risk, and we've seen with the spread, particularly in our northern suburbs and now starting to get into the southeast, it is household to household transmission that's driving our growth in numbers. And 770 odd cases today, that will translate in the coming weeks into more people going into hospital and more people going into ICU. So of course we're worried about last night. If people did use that to get together when they shouldn't have, there'll be people walking out of that with COVID transmission as a result, and our health system will have to pick up the pieces in the weeks ahead.
In
Jerome,
regards?
Oh, sorry, I was going to say, I think today is the first time ever that we've cracked 8,000 active cases in the state.
Yep.
In terms of our ability to manage that,
Yep.
where are we at compared to this time last year in second wave? And are you still confident that we're doing what we can to keep control of it, or is it just going to rise exponentially?
Yeah, look, I mean, it's been an awful lot has happened in the last 12 months to give us confidence that we can handle it both from a contact tracing case management point of view, but also from a health system point of view. So that preparation, that readiness is there. We're very confident that we've got those 8,011 people that are currently active with COVID will be supported by our systems in terms of contact tracing, making sure they go into those appropriate health service pathways, and that crucially our amazing health services have to pick up people who are then needing that additional care, either at home or in the hospital setting. So I think those plans are in place, that capacity is in place to manage our way through that. But let's not forget, we've got 8,000 people who are seriously ill, who've got a condition they do not want to have, and who've got something which is not only damaging to them potentially, but also of high risk to others around them.
That COVID positive protester, has there been any transmission regarding that person who's in hospital?
No, so so at the moment we're aware of the one individual that's in V's. So we're obviously continuing our contact tracing work. We've not found any other directly related cases to that individual yet. We're also aware there is an individual in Geelong who was at the protest who's also turned positive. So there's another little flurry of activity going on around them.
Any knowledge of where those people acquired the virus?
No, I mean again, this is where, as Mark says, with 8,000 cases in the community, we're seeing community transmission as being where people pick it up. But when you see, when you see such a large number of people all out on the street together, all doing the things which are in breach with directions, regardless of why you're there, that is an absolute risk. So if you're going to hang around in a crowd of 500 people, then if there are COVID positive people there, and the chances are there will be, then this is where you're going to see some
And
spread.
then a couple of police officers who have been into
Yeah.
isolation to
Yeah.
know if they've returned positive and
Yeah,
negative?
so far, and again, a huge thanks to VicPol members for the amazing work they do, not only on protests, but generally. They're still furloughed, they'll continue their isolation period. To date, all those tests have come back as negative.
What
Any
was the
further
nature of their
information?
contact with the relevant protester? Did they arrest that person?
I'm not aware of that, Rachel, that's an operational matter for them.
Any further information on the Geelong case you just mentioned? Do you know where they, their age, their male or female,
Yeah, so
where
we
they
have
attended?
a man in his 30s who lived in Geelong. He turned positive a couple of days ago. He was in day before yesterday's numbers, and who attended the protest. Which bit he was, which bit of the bridge he was on, I don't know, don't care. But you know, it's the risk. It's the risk that either he probably unlikely to have contracted it there, but certainly is now a COVID positive case and would have been at that protest during his infectious period.
Is he in hospital?
No,
Where do you believe he contracted it?
don't know.
Don't know.
And so he attended on the Tuesday when it was at the Westgate Bridge? or-
I'm not sure which day he attended, but again, my point, Rachel, is that you know the protests are not immune from COVID, and the reason we spend so much time talking about avoiding public gatherings, avoiding, you know, we don't do this for kicks. You know, we're not asking people not to meet each other because that's a fun thing to do. It's an incredibly difficult thing to do. But protests are not immune from those transmission risks, and we now have at least 2 individuals that we're aware of, both of whom tested positive, one in regional Victoria, one in the city, both of whom were at the protest, and that will have been a risk to the people around them. I suspect there wasn't a QR code for the demonstration.
How confident are you that anyone who might have got infected at the protest is actually going to show up for a test?
Well, 2 of them have, so that's a good sign. And if I look at the daily testing numbers, a lot of people are coming forward, and if we look at the history of this over recent weeks, you know, we're also seeing significant numbers of people coming into emergency rooms or going into GPs with advanced symptoms and testing positive very late in the day. So, as the way we've seen this virus works, I mean, absolutely, there's a chance that people get this virus, they're asymptomatic, they don't notice anything, and the virus passes through them. It might pass on to other people, but it leaves no effect on them. We have also seen cases, I'm not the clinician here, but we've also seen cases where people are presenting very late in emergency rooms or at GPs with advanced symptoms, having been infectious for a large number of days. And this virus will find you out.
Do you have a breakdown of the number of people in hospital that are vaccinated and unvaccinated and in ICU?
I do, yeah. So 80% of people, 80% of the 325 people in hospital are not vaccinated. 5% are fully vaccinated, and the remaining 15% have had 1 dose. And just on the, we talked, I think, a few days ago, we have, particularly with a few of the aged care outbreaks, and they haven't changed significantly in the last few days, which is good news. But we have moved a number of people into hospital for their own well-being, and that will account for some of those fully vaccinated numbers.
And in
What
terms of
proportion?
ICU, how many are fully vaccinated that are?
There are, I would need to come back to those numbers, I have those in my head.
What proportion of that 5% who are fully vaccinated would be those aged care people you mentioned? Is it
There'll
nearly
probably
all?
be around, well, if you look at the rough numbers, there'll probably be around 1/5 of those are probably related to the aged care intake. So 1% of that 5%.
So there are 4% who are fully vaccinated?
Yeah, that's right, yeah. And again, just, you know, let's be very clear, again, this is a Chief Health Officer question, not mine, but I'll give it a whirl. You know, the vaccine doesn't prevent absolutely everything, but it massively reduces your risk. The fact that we've got a 77% vaccinated population, but 80% of people who are in hospital are unvaccinated, I think pretty much speaks for itself.
Thanks very much, everyone.
Thank you.
I didn't forget, but I forgot my card.
Oh, yeah. Also, your question about Freestyle Park, Remy Barber did a yarn about it a couple of weeks ago. It's been full for a couple of weeks.
Has it, sorry.
No, it's.
Was
like-
it from me? I was getting sent these
Yeah.
questions and I'm like, I don't know what I'm asking.
No,
It's
it's
but
a-
also, like, if people are infected and they've been in their house,
Yeah.
not letting people go in.
Go
because
in.
it's-
Yeah.
They think it'll have already